You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Welcome to another edition of the RN Mentor podcast. I'm super excited today to be joined by Dr. Jacquelyn Taylor. She is the Helen F. Petit Professor of Nursing at Columbia University School of Nursing, where she is also the founding executive director of the Center for Research on People of Color. Dr. Taylor has been a trailblazer in cardiovascular genomics research among minority population and diversity and inclusion efforts, having been the first Black woman to earn tenure at Columbia University School of Nursing, New York University School of Nursing, and the Yale School of Nursing. Dr. Taylor has been recognized for her contributions to the advancement of biomedical sciences, healthcare, and public health, having been elected to the National Academy of Medicine in 2019. Dr. Taylor is committed to mentoring and advancing health equity as she received the Columbia University Irving Medical Center 2021 Mentor of the Year Award and the 2021 Friend of the National Institute of Nursing Research President's Award for her significant work in race, culture, and disparities in healthcare. Dr. Taylor has been PI of many studies, including but not limited to an R01 from the National Institute of Nursing Research, the Intergenerational Impact of Genetic and Psychological Factors on Blood Pressure, a Presidential Early Career Award for Scientists and Engineers Award from President Obama in 2017 are among her many awards. In addition to leading these grants, Dr. Taylor founded the Office of Diversity and Inclusion at Yale School of Nursing and served as its inaugural Associate Dean of Diversity, and then went on to become the inaugural Endowed Chair of Health Equity to develop and direct the Myers Biological Laboratory at NYU before joining Columbia University. Welcome to the show, Dr. Taylor.
Thank you so much. And thank you so much for all your kind words and for the invitation to participate in this podcast with you.
Thank you. Thank you. Yeah, I'm glad we were able to finally connect and have you on the show. So we'll get started right off the bat with, how did you get started in the world of nursing?
Oh, gosh. I guess I should start very early on. At the age of 6, I was diagnosed with Wilms tumor. It's cancer of the kidney. And so I received excellent care at University of Michigan Children's Hospital, and I was provided care by an African-American nurse, and her name happened to be Jackie. So it was the first time I really had interacted with, nurses at the bedside, being a child. But after that, I saw that and the care that I received and how she was able to help keep me calm during lots of different procedures, chemotherapy, surgery, work with my parents and my siblings and keep them, abreast of all the things that they were doing and, what they could expect. And I really thought, that it was a really amazing thing. And I wanted to do that when I grew up. I wanted to help other people.
That's
so
amazing.
that was my first experience and thoughts about becoming a nurse. I don't think there was anyone else in my family that was a nurse. I'm the first in my family to go to college. I have there were 11 of us, 11 children in my family. My father worked for Ford Motor Company in Michigan, and my mom was a stay-at-home mom, took care of us. So there was really no, I didn't have siblings or parents or any history of people in my family as, nurses, but just that experience of having someone care for me in such a great way. It was something that I wanted to do, and my family really encouraged it too, because they had a great experience and was happy with the care that I received at the hospital there. And then I just, I continued on and was able to go to Wayne State University in Detroit, and was accepted into the nursing school and was able to receive all 3 of my nursing degrees from there.
Oh, wow. That's amazing.
Yeah.
Yeah, some of us, like, once we find a place like we like and it offers everything we need, it's one-stop shopping for us. Why mess up the formula, right? So
that's right. I didn't know about all the opportunities that were available in nursing. As a child, I had that experience and a nurse that took care of me. But once I entered into the nursing program at Wayne State, I learned about nurse practitioners. I learned about, you can get a PhD in nursing. I learned about all the different opportunities and things that will be open to, in careers in nursing. So I continued on at Wayne State. And it's funny, I always tell people this story because I applied to the master's program. And I thought, I'll just apply to the master's program. But then they had this BSN to PhD program. And my advisor at the time, she was a pediatric nurse practitioner. I applied to the pediatric nurse practitioner program. And she said, why aren't you, you have great test scores and your grades are excellent. Why aren't you applying to the PhD program, like the, PhD, where you can get your master's along the way? And I had been discouraged by faculty that said, well, you have to work so many years before you can apply to a PhD program. And she said, absolutely not. That's not true. And so she just, and it was the same requirements. You just had, I had the GRE scores and all of those things. And she scratched out the, on the top of the master's application and put PhD. So, it was, I'd love to, let people know that, all along the way, I've been very fortunate to have great people in my life to ask the question and help guide me and say, well, why not? Why aren't you doing this? What is it that you want to do? And then that will, help guide me to do those things. Like, even if it's just, crossing that out and saying, no, you apply to the PhD program. And sometimes we need that little push, and I hope to be that for other people in terms of mentorship and sponsorship.
That's so, I mean, it's amazing that you bring this up, because we do it so much as a profession where we try to put like the experience of what we've done in the past and has been traditional in the profession without any evidence of why we do it that way, or without any, just because we've always done it that way. And that's what we advise for people. And we see the results of people who are going through these programs that are pushing them through and making them, putting them in roles earlier in their career where you don't have to be, have like 10 years under your belt before we do this kind of stuff. But we push that model so much, and there's no evidence that once you come out the other side, you're any better or worse.
Well, and we have to look at our other scientific colleagues, like engineering, basic sciences.
Exactly.
There's no requirement that you work, 5-10 years before you apply for a master's or a PhD in those disciplines. And it's highly encouraged for people to go straight through and to complete the terminal degree.
Right.
So, if we encourage that more, we may not, it can help alleviate, I think, some of the things that we see now in terms of faculty shortage, shortage of faculty at the administrative level. If we think about more succession planning, we can be more effective in helping people to get through in a more timely fashion.
Yeah, I agree. I mean, so many times, like when we're searching for faculty positions, we're like, some of the applicants, like, nothing wrong with that, but so many of our applicants are people who have already had a full career and now want to give back to the profession as faculty, which is fantastic. But we also don't have the opportunity to have that faculty with us, like 20, 30 years, because again, they're at the end of their career and they're just looking to give back at that point, which I love, because I love being able to receive that experience from academic perspective. But again, from a if you look at it from a scientific community perspective, so many of our colleagues who are in other professions are starting in their 20s and 30s.
That's right.
As researchers.
Yeah, the average age of a PhD graduate in nursing is what, 48, it's much older. And then by the time you complete, if you go into a postdoc for a couple years or so, and then if you go into an academic position, and then you have 7 to 10 years before tenure, depending on the institution that you go to, by the time you reach tenure, you're retirement eligible.
Right? Exactly.
So how much time are you really have to contribute to the profession and to advance science? And the more time we have, I think the more innovation and the further we can go, if people can get an earlier start.
I think part of that has to also do with so much of the work we do is we're so concentrated on bedside nursing that we sometimes don't realize the contributions of nursing in the community, within the scientific realm, within like benchside research. So there's so many things that we do that is not just bedside, but it seems like the profession as a whole, we concentrate everybody's career at the bedside, which has its own benefits. But I think,
and I can see that, because we do need the work enhanced workforce issues. We do need nurses at the bedside. Right. If I get sick, I want nurses taking care of me.
Yes, absolutely, absolutely.
But we also need to enhance, the nurse practitioners, the DNPs, the PhDs, all of the advanced, because we have this advanced training and we have the capacity and the knowledge base and the skill to advance healthcare in many ways, not, at the bedside, in health policy and, scientific research, bench to bedside to community, being a part of the community outreach, mobile clinics, all of that. I think, we are essential in all areas. So I think we need to help grow each one of those layers and try to identify where people have their strengths. Who are those people that love clinic? Who are those people that love to do work in the laboratory? Who are those nurses that love to do the data analytics and the big data and population health? Who are those practitioners that want to start primary care clinics, mobile clinics, and take care of people in the community? So it's working towards people's strengths and helping them to develop those strengths.
Do you think we do that identification in, like, let's say we have students in our bachelor's programs or even our ADM programs? Do you think we're identifying students, or are we just trying to get them out the door to go work bedside?
I think we missed a lot of opportunities. I think we can do a better job at it. I'm sure some places, are really good at those things, but then you have some institutions like I'm at Columbia University. We don't have undergraduate nursing. So we have to look towards other universities or schools of nursing that have undergraduate nursing to think about how we can create a pipeline. And I think that's what we can work harder towards, like creating a strong pipeline where students are interested in, continuing on, if that's their interest, but helping to facilitate how they can do that without having a break in their education. I know it's very costly to continue on in nursing school. That's one of the, huge barriers that I faced. Like I said, I came from a family of 11 kids, with one parent working. So there was not a lot of resources. But I was able to, go to a state school that provided me with a scholarship and provided other resources, things that I could apply for in terms of, continuing my education. So I think that's a huge barrier for continuing into advanced degrees, master's, PhD, DNP, because it can become very costly. And if people wait to continue their education because of a cost barrier, how long will that take? Particularly, when you think about people that are starting families or, have other competing demands, if they're taking care of, aging parents, and so on and so forth.
Yeah, absolutely.
So I think it's imperative to think about, scholarship opportunities and ways to support students to continue through the pipeline, all the way from undergraduate, well, quite honestly, all the way from high school, to try to get, high schoolers interested in nursing and all the opportunities that are available in nursing, and then helping to shepherd them through a BSN, a master's, a PhD, DNP, whatever, whichever road they feel they should take, and into faculty roles.
Yeah, absolutely. Yeah, I 100% agree. I think we're not tapping the resources that we have. And one of the reasons, actually, I feel like I say this on every podcast, but one of the reasons I started the podcast was to really introduce what else is out there for my students, because I really started this podcast for my undergraduate leadership students that I had at a previous institution. And it just sort of taken off, but really exemplifying like what nurses are doing after they're graduating. And so many of my students are like, I never knew I could do that. And I think those are missed opportunities for us, right? To introduce what nursing is doing beyond the bed, at bedside and beyond the bedside. But I think we do a really good job from an undergraduate level at what they do at the bedside, but we're just not doing what else is out there for them.
Well, and then also being very multidisciplinary in our approach, because we do sit at the intersection of both, basic science and social science. We embody both of those things. And so we have a lot of skill and a lot of talent that we can contribute to both, both sides of the fence here. I can tell you from my experience in undergrad, I had the great experience of being able to take part in this in an R25 funded grant mechanism for, it was called MBRS, Minority Biomedical Research Support Program. And that was at Wayne State. But it was, a program where I gained a lot of experience working in the laboratory with basic science researchers. And I was a nursing school student.
Wow.
But, I was hit with some reason, not from basic science researcher side of things, but from the nursing side, asking me questions like, why are you doing that? That's not nursing. And I couldn't believe what I was hearing. I'm like, well, but we nurses have to understand the basic physiology of what's happening with a person in order to figure out how to respond and how to create a care plan that's appropriate for that person. So mind you, this is before all the terms of like precision health or precision medicine, but it was hard for me to understand. And even now, I'm glad that I had that experience, because I feel like it made me a better nurse, because I could understand the basic science. I knew what was happening in the patient's body before it actually happened, so I could intervene early.
Yeah.
And then I had that great experience of working in the lab and doing all the basic science work. So it was really translatable to the bedside and to the community before we had the term clinical translational science. What we're really describing when we talk about clinical translational science and precision health is nursing. That's what nursing has always been. And so that's why I had so much difficulty, like, well, what do you mean that's not nursing? That's exactly what nursing is. We understand these things from a basic level, physiological level, to the symptom presentation. And, we try to intervene before you have these problems and issues. And, I think that if we could do more programming around hands-on experiences for high school or undergraduate students and get them more involved in things that, opportunities that are available in nursing. So everything from bedside nursing to industry to, device development to, entrepreneurship in nursing to, the opportunities are limitless.
Right.
And I think a lot of times when people think about nurses, you think about what you see on television, particularly what you saw on television during COVID-19. You see the nurses that are exhausted with the, with the sores on their face from wearing a mask for, 14 hours on end. And yes, nurses were absolutely heroes. Don't get me wrong. And they gave tirelessly and endlessly, particularly during the pandemic.
They did. But
we also need to show but it showed like how nurses worked to worked to, their just exhaustion.
Right.
But we don't see the messages of the rewards, though, how people, a lot of people did recover. We made an impact on these people's lives. Why we become nurses, why we are caring for human beings. We are providing our skills and our labor because we care about people's well-being. And I think that needs to be more of the messaging of the rewards and why people go into nursing and why it's important to become a nurse, rather than all the negatives. Of course, there are, anything you do, there's pluses and minuses, but I think the rewards outweigh the negatives.
Yeah, absolutely. You just triggered a thing for me, having the ability of work from home once in a while. Like it was, you hit the nail on the head on this one, just because I think we see the labor of nursing, right? Mm-hmm. But we don't see what the outcomes of the contributions are. Right. I don't know if you're familiar, I'm sure you are, with Good Morning America. Robin Roberts was on there. Yeah. She had cancer a few years back. She went through this whole treatment process. A few weeks ago, she recognized 2 of her transplant nurses who were essential for her recovery and where she is now. And there's a whole thing about it. But this is like 10 years after she's gone through this process that she came back and she recognized her 2 transplant nurses that really shepherded her through this process of going and recovering. And those are the outcomes that we often don't see. It was their skill set, their knowledge that really got her to this point. And we don't do enough of that.
And I think we don't do enough of honoring nurses with recognitions. So, for example, and I've said this, and I interviewed Ibrahim Kendi X on his book, How to Be an Anti-Racist, and he's a MacArthur Award winner.
Wow.
How, and tremendous work, great author, great writer, and it has nothing to do with him, but I just bring it to the forefront here. Why is it that we have these prominent awards like the MacArthur Genius Award during COVID, during the World Health Organization Year of the Nurse, but no nurses receive these awards? It is astounding. Like, are you kidding me? I think one nurse in the 80s has won the MacArthur Genius Award. In the entire time there has been the MacArthur Genius Award. I think that is a tragedy. I think there needs to be more national recognition of the contributions that nurses make, all the way from the bedside to, practitioners in practice, those providing care to people in clinics, all the work that was done to transform clinics to fever and cough clinics, to testing centers, to immunization clinics. It was amazing to see all the things that nurses did, and that they were able to do it during a time when everything was just tumultuous. Yep. And they did it, and we were better for it as a society. But how are we recognizing all of this tremendous work and these efforts and the imprint that it has made? I think it's a tragedy. I think nurses should be recognized for the Shaw Prize, all these prizes in life sciences, biomedical sciences. We need to have more nurses and practitioners and nurse scientists recognized.
Absolutely. Not to point blame, but do you see that as a professional? Is it a professional fault that we don't do enough to recognize our colleagues in the profession? Because so many things come up, and unless somebody, I'm one of those people where I hate to submit myself for things. I don't submit myself for things, right? But waiting around for other people to recognize work, I see so many great people around me, so many great colleagues that are doing incredible work and never, as you mentioned, never get recognized for it. Do you think that's our own fault as a profession, that we need to do a better job at that? Or
I think we need to do a better. I think people are very humble, especially
yes,
people that are doing great work. They're more interested in the work and they don't care about the recognition.
right.
But I think it's important for the profession. So I can applaud the people that are doing the work. They're not doing it for an award or to be recognized. They're doing it because that's truly where their passion lies, and they want to help people. And I love that. That is exactly why you should do what you do. But if we want to advance the profession, I think we need to do a better job at promoting each other.
Yes.
I know it's difficult to promote yourself because, you know, I would have difficulty promoting myself or nominating myself for an award, but I would hope that my colleagues, you know, and they have, like my colleagues have nominated me for things. I nominate my colleagues for other things. But I think we need to also do a better job at becoming more multidisciplinary, so that some of our multidisciplinary colleagues that are asked to nominate people for these things like MacArthur or Shaw, maybe nurse scientists are not asked to nominate people. I don't know.
Right.
Maybe, you know, people that are physician scientists or basic scientists or people in population health are asked to nominate people, and they don't necessarily think of their nurse scientist or nurse clinician colleagues as eligible.
Right.
So I think just, you know, I guess it's educating and working with people across disciplines could open up more opportunities for recognition.
Yeah. I mean, you've mentioned a couple of awards that I've heard of before, but as I'm sure many other people, I've never even thought about a nurse receiving it. I think
They
that's
absolutely should.
and they should, absolutely. And I think we just like I don't yeah, I guess we probably also need to do a better job at educating nursing about what we're even eligible for, or what kind of things are out there, because we see things like, you know, that are nurse specific awards, but I think nursing, I mean, we've been siloed forever. So I think that's another issue, is like we just haven't looked at other professions and what awards are out there so we can recognize colleagues for them. So that's a great point. That's a great point. I want to get back to your how did you we figured out how you ended up in nursing, but how did you decide, and I'm assuming some of the work that you did as an undergrad working with the biological sciences led to some of the work that you did in your career moving forward. How did you decide what you're going to be studying from a researcher perspective?
Yeah, that's kind of a funny story too. So I was an undergraduate student at Wayne State, you know, just arrived on campus, and, you know, I was looking for a job, to be honest, you know, poor college student. I need a job just so I can have money. So I went to my, you know, the counseling office where they can help you find like work study jobs on campus. And I went into the work study office and I talked to the counselor, and they say, okay, you know, what are you interested in? And so I started talking about, you know, people in my community have high blood pressure. I want, you know, I'm 18 years old. I want to cure hypertension, basically. You know, very naively, but, you know, I want to work on this, and I don't want this to be a problem in my community anymore. My father has hypertension, you know, people in my family have hypertension. I want to know, you know, how to affect change in this area, particularly in Black communities. And, you know, she was being very sarcastic and just flippant with me, like, well, I think you should go and talk to the chair of the physiology department at the medical school. And as an 18-year-old, I think she's being very serious. I went for advice. You're giving me advice, so I'm going to do what you said. I'm like, oh, well, who is that? You know? So she says, well, this is Dr. Dunbar, Joseph Dunbar. And I said, okay, you know, if you tell me this is what I need to do, yeah, I don't know any better. I'm going to go do that. So I went over to the medical school. I didn't make an appointment. I didn't know what a department chair was. I'm 18 years old, just, you know, stepping foot on campus for like, you know, the first semester. So you tell me to go over to the medical school and talk to Dr. Dunbar, I'm going to do that right now. So I go over to the medical school and, you know, the department chair, he go into his office, he has an assistant there, and I introduced myself. I'm Jackie, you know, I'm a student here. I went to the advising office. They told me I should come and talk to Dr. Dunbar, and I give my whole spiel. And I know, you know, now being on the other side as a faculty member, I'm sure, you know, the assistant is probably like, who is this person and why is she here? So she calls back into Dr. Dunbar's office. He answers the phone. I can only imagine what he could have been thinking, like, why is she here? But he was gracious enough, you know, and this is, you know, at the time when people were in their offices too. He was gracious enough to see me, and then we had a conversation, and he said, okay. And that's when he, you know, let me know that he had this grant and I could, you know, work on this grant as, you know, a student research assistant, and I could work in one of his labs. And, you know, if I'm interested in that, and it's, you know, he did work in hypertension and diabetes. And I was like, yes, that's perfect, you know, and I had no idea what I was signing up for, but I think sometimes that's really good because you are able to, you know, open your eyes to various opportunities. So when I got into the lab, you know, I was doing everything that doctoral students and postdocs were doing. And it was because no one told me that I couldn't. I said, well, you know, show me how to do that. You know,
Perfect.
Show me how to do cell culture. Show me how to use the spectrophlorimetry machine. Show me how to do, you know, develop these, you know, these gels. You know, how do you do that? Show me how to dissect the aorta from this Wistar rat. I can do that. I wanted to do everything, and they let me. And it was fantastic. And so that's how I really was interested in not only learning how things work in the human body, how, you know, vessels constrict or relax based on, you know, different elements that you expose them to, whether it's different medications or different environmental exposures, but then also thinking about how does this work in a human? So even though I was doing this work in the lab, I still wanted to have the human interaction and translate that to how will this help people? If I'm doing these experiments on these various drugs, how will this help or change the care that people will receive when they're, you know, coming in for hypertension, for help with their blood pressure? Now, mind you, I continued on and became a nurse practitioner, and I was able, you know, I had a mobile clinic, pediatric mobile clinic.
Wow.
But then as I continued on to my PhD, I wanted to learn more of not just how this affects people that already have hypertension, but what can we do to identify risk factors early in life in children so that we can intervene early so they don't develop hypertension at an early age like their parents or their grandparents. So that's what really started my across the lifespan approach to doing work and looking at genomics across the lifespan and cardiovascular genomics. And then that also led me to do a postdoc in urban health aging, because I was very competent in my skills as a clinician, as a pediatric nurse practitioner, but I felt like I could benefit from learning more about what happens in the physiology of a person as they age in terms of vascular physiology. So that kind of rounded out some of my education. But once I started out as faculty and doing research in cardiovascular genomics, I quickly learned that the training that I received in statistics was not sufficient for genomics and looking at advanced genomic data analysis. So I applied to a program at Washington University in St. Louis. And again, this was a program that was an R25 funded program to enhance training in cardiovascular genetic epidemiology, working hands-on with large data sets like the Hypergen data set, the Genoa data set, Jackson Heart study. But in the application, in the ad that came out for people to apply, I thought, oh, this is great. You know, you spend 2 summers in St. Louis and you get to, work with the leaders in cardiovascular genomics. And I was like, this is perfect. That, really helped me advance, my studies in this area. The application was open to basic science researchers, physician scientists, and statisticians. And so I called the director, Dr. D.C. Rao. He's still there now. And again, I think it was just, I didn't know any better. And I just, when I have these questions, and I think now I encourage people to do the same thing. If you have questions, just ask, because maybe it's just an oversight. Maybe, someone had not thought about that, and you can, rectify this in terms of including nursing more. So I called the director and I said, I'm a nurse, I'm doing this work and I'm very interested, but I see in the application that it's, only open to these disciplines. I would like to apply. Would you consider my application? And I think my directness to him was, he said, oh, I think it was truly an oversight. They just had not thought about nursing. And so, I went there. It was a fantastic experience. I've encouraged other nurses. They have completed the program. And now I think, they really look to nursing like, please send us some more nurse scientists. Like, we have had such a great experience with the nurses that have gone through this program. I think that, that we would never be overlooked again in that particular way. And I think it really gets to the message that we were saying about different honors and awards, that we have been so siloed. I guess while we have been building the profession, but now at this point, I think that it's time for other disciplines and professions to learn about what it is that we have to offer, and not just as complementary, but also as leaders, that we can lead a lot of these investigations. I can lead a study on cardiovascular genomics because I can do all the things, everything from designing the study to working with the communities. We do that as nurses, already working with people at the bedside and in community care. I can do the laboratory analysis. I can do the data analysis, and I can translate that information and disseminate it and say how it's going to not only what the statistical significance of it is, but what is the clinical significance and how does it translate to care for people? Yeah. And I think we don't really value that because we do it all the time, but I think it's really like gold to everyone else that we have these skills. And, we think it's just, it's innate because this is what we do as nurses. But I think when you look at other disciplines that, if you look at a basic scientist, their objective is not to translate it to clinical practice. Their objective is to say, is this significantly changing something or not? And that's it. On the clinician side, maybe clinician scientists are looking at how does this affect care or treatment, but they may not be looking at the basic science side or how it translates to caring for people in the community. But as nurses, we look at all those things. We take a holistic approach to our care and to our research and to our practice and to our translation.
I agree. And I think part of what we need to do better as a profession, as you mentioned, is really educate other professions in the capabilities of nursing, because if they knew what nurses were capable of, we would have been, nurses would have been part of the people who could apply for that application that you had to call in for. So I think a lot of it has to do with those sort of stereotypes of what nursing does, and and unfortunately that leaves us out of a lot of conversations that we should be included in, because we do have the skill sets. So I agree.
And I think we're our worst critics because, like I said, early on in my career, I was told, why are you doing that? That's not nursing. I don't
Right.
think we could ever say those words to anyone coming through nursing ever again. My response is, I'm a nurse and I'm doing it. So that's,
Right.
you know,
Yeah,
that's
absolutely.
really
Yeah, yeah. You're really saying I'm bringing a nursing perspective to it,
that's right.
but it doesn't mean that we shouldn't be
In
in
that
that
area
arena,
of, that's right. That we
right?
can cross various disciplines and that we have a lot to contribute to all areas.
Yeah, absolutely. I just want to be cognizant of our time, and I definitely want to touch on some of your EDI work that you have been doing, in addition to your roles. Can you explain how you decided you're going to, because you actually started a program um, at Columbia. So how did your EDI work kind of blend into your work as a nurse scientist?
Well, from the very beginning, all of my work has been focused on cardiovascular disease and underserved communities. I started out, like I said, in Detroit, serving the Detroit community. That was an area of need. Hypertension was one of, Detroit had one of the highest incidence and prevalence of hypertension, particularly in the Black community across the country. So I think it's important to promote and to look at these communities that have been overlooked for so long. And also to, in addition to focusing my work on Black and Brown communities, I have worked to help grow the workforce and faculty to include more diversity in those ranks as well. The student body, faculty, and in all areas. Because it's important that we see examples of people doing the work so that we can really envision ourselves doing it. Like I said, when I first started thinking about nursing, it was because I was provided care by an African-American nurse at the bedside. And it was not a thought in my head until I became sick and saw that. And I really thought, well, I can do that. So I think we need to have more examples of underrepresented minorities showcasing people doing this work. We need to increase studies on underrepresented minorities by underrepresented minorities, so that we can be more reflective of the communities that we serve. I think, particularly in the genomic space, there is not enough work done in Black and Brown communities, and so we need to increase representation there, because we can't really say if the genomic databases that we have don't have representation, it's very difficult for us to draw conclusions on what are variants of risk for particular diseases and how does that translate to communities of color. And then thinking about the social aspects that can also affect health. So this was another way. Just going back to my training, I had the great fortune of being trained by multidisciplinary faculty. So even though I had my nursing faculty that were there to support the work that I was doing, my K award, my mentee for that was not, my primary mentor was not a nurse. It was a genetic epidemiologist who was in the School of Public Health at the University of Michigan. It's Dr. Sharon Cardia. And then one of my other mentors that was very influential in the work that I do today was a social scientist, Dr. James Jackson. So he helped me think about, okay, you're doing great work at the bench, looking at, genetic risk for hypertension, but what are some other things that you think that might interact with that to result in, these high rates of hypertension among Black communities? And so really looking at some things like racism, discrimination, trauma, social support, what are some of the factors that can influence why we see these disparities in this particular healthcare outcome? And so, again, that really helped me to think about, environmental factors, help me think about social factors. And this is before we had the term social determinants of health. And so if we work more multidisciplinary, I think that can help not only broaden our viewpoint, but it can open doors and opportunities for nursing as well.
Absolutely. Thank you. Now, from a leadership perspective, you've taken the leadership role in creating some of these programs with different institutions. What does nursing need to do a better job at leading some of this work as opposed to just being part of some of this work?
I think nursing needs to elevate minority faculty to administrative leadership roles, and not just directors of diversity, although those are, don't get me wrong, it's very important. And I was one. I was an associate dean of diversity.
It's a great first step. It's a great first step.
Well, no, I don't think it's a first step. I think that's a step once you're tenured, because I think you still have the responsibilities of going through and earning tenure based on your scientific expertise, whatever that may be. And not all other faculty don't have this added responsibility of being the director or dean or associate dean of diversity. And I think it's very unfair to minority faculty to assume all of this burden because they may be the only minority or one of few minority faculty that are on staff.
Right.
So I think it's, if we really believe that diversity is important, then it should be a shared contribution. It should not just be one person's response, and it should not be the responsibility of minority faculty to undo all the racism and discrimination that has been created over 300 years at these institutions.
Yeah, absolutely.
So we can do our part because we want a better place for all of, for all people work, including ourselves. We want to work in a place that is not discriminatory in nature. We want to work in a place that's very supportive and we have a sense of belonging. But I think it's the first one step is to make sure that we have senior faculty in leadership positions that are not just diversity deans. So who are your deans of research and your vice deans of faculty advancement and your vice deans of student support and advancement? Who can minority faculty and students look toward to say, I can get support from this person, or I can do that one day? Are we training? Do we have training programs for junior faculty to work with these so that they can think about succession planning? So in the future, they can say, well, maybe I would like to be an associate dean of research or faculty advancement or, student advancement or what have you. But I think thrusting people into roles that they're not ready for is not good for the institution. It's not good for junior faculty. It should definitely, we have to do something more. We need these diversity roles. But who are the most appropriate people to take on these roles? It's definitely more senior faculty, and we need more senior faculty as deans of prominent nursing schools, so that we show that representation. We need more faculty of color that are in these vice dean positions, provost positions, vice provost positions, all the way from the top, so that we don't feel like we're just relegated to only diversity roles, even though this is not what we received our training in. I have been trained as a cardiovascular genetic nurse.
Right.
Now, mind you, all of my work has centered around diversity, equity, and inclusion because I study diverse populations. But it's not fair to consume junior faculty that have not obtained tenure yet with these roles. It's very unfair. I don't recommend it. I know everybody wants to contribute and do their part because it's something you're passionate about, but you should be given the same opportunity to grow your program of research just like everyone else without the added responsibility.
And just to clarify, when I said it's a great first step, I meant it's a great first step for these institutions to recognize there's a need for this role. So yeah, I absolutely agree with you. But how do we integrate it so it's everybody's responsibility?
Well, if we tie it to annual evaluations,
yeah, absolutely, 100%.
If we tie
100%.
it to that and we monetize it, I think that's one way.
We need to have accountability. That accountability.
There has to be some accountability. Yes.
Yes, that we're integrating in our teaching, in our work that we're doing, in the colleagues that we are working with to develop the research that we're doing. So yeah, I absolutely.
And so just like, in our evaluations, if you have a tripartite mission, on, research, teaching, service, and you are evaluated, DEI or ED, diversity, equity, and inclusion should be added to that. And we should be evaluated on these 4 things.
Yeah.
And if you don't contribute anything to it, then you don't receive, the increases that you would receive as if you did not contribute anything to the research mission or the service mission or the teaching mission.
Right.
So weight it. If we weight it as heavily as we say that it's as we say that it's important to us, then we see differences.
Yeah, it needs to be important for everybody to, because if I don't think I'm going to be held responsible for it, or if I'm not accountable, we won't see the outcomes that we like to see. Definitely. So again, want to be super conscious of your time. Anything else you want to share with the audience?
No, I just, follow your passions, be bold, be fearless, but also remember to be kind, because we are nurses, we're taking care of human beings. So, and continue to follow your dreams.
Great. Thank you so much. Thank you for being with us today. We have been listening to Dr. Jacquelyn Taylor. She is the Helen F. Petit Professor of Nursing at Columbia University School of Nursing, and is the founding executive director of the Center for Research on People of Color. Thank you, everyone, for joining us, and we will see you again soon. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.